So welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. I'm your host, Jay Gill, the owner and a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we partner and collaborate with practitioners and create custom medications to help our patients get better. Joining us today is Dr. Eboni Cornish from the Amen Clinic in Reston, Virginia. Welcome back, Dr. Cornish.
Yes, thank you. Happy fall to everyone. Happy October.
Yes. So in our last episode, Healthy Minds During These Crazy Times, we ended our talk on detox or detoxification. We decided this was a topic in itself that we should talk about. To our listeners and viewers, this is a very timely topic of discussion. We're concerned about the second wave, the second shutdown. Rising cases of COVID are going to happen. So instead of being fearful, let's take care of our bodies, and one of the ways is by detoxifying. So before we begin, Dr. Cornish, could you please introduce yourself?
Yes, so I'm a functional medicine physician at the Amen Clinic in Reston, Virginia. One of the things the Amen Clinic focuses on is integrative psychiatry, where we use SPECT scans in order to better evaluate the brain as we try to end that terminology of mental illness. And as a part of those evaluations, we do functional medicine evaluations. And being that I've been working in functional medicine for over 10 years now, I have a primary focus of understanding the root cause of disease. I specialize in the treatment of tick-borne diseases as a member and a board member of the International Lyme and Associated Diseases Society Education Foundation. One of my goals is to train professionals, doctors, NDs, DOs, on how to treat this very complicated illness. I also treat mold illness, genetic predisposition for disease, PANS and PANDAS, and among other chronic conditions. But like Jay said, this is very important because you hear that word detox thrown around quite a bit without really a clear understanding of what that means. You may hear of detox diets or detox drinks or, detox water fast. But today we hope to really give you a comprehensive medical approach that not only utilizes natural strategies for healing, but more or less equips you with preventative strategies to help kind of cleanse the body and cleanse the mind.
So you are so correct because, I think of detox as that twice a year cleanse type of diet that I do, Mm-hmm. And to another person, it may mean detoxifying themselves of some kind of addictive behavior or even drugs. So let's start this discussion and clarify what is detox and are there different types of detox programs?
And that's a great way to look at things because detoxification simply means utilizing your body's organs to remove the waste. And you can do that in numerous different ways. One of the major organs in our bodies that allows for us to detox is our liver, as well as our kidneys. But we're going to focus today on other body systems, not only just the liver and kidneys, but how you detox the gut, how you detox the brain, and what things we can do as far as nutritional strategies to help you just cleanse the system in a safe and healthy way, just for you and your family. Because we want to build a robust immune system. But not only that, we want to prepare you. After October, the holidays come next. So what a perfect time as we're all reentering society, kids are reentering schools, people are reentering works, that we are really primed and optimized so that we can fight off all these toxins in the world. Because our society right now is much more toxic than it ever has been, than the toxins that our parents dealt with and grandparents. We have such a high toxic burden. May that be from pollution or from foods or just from even the stress of what we're all dealing with right now in society. So having a good, really comprehensive detoxification plan is really going to help us get ready for the fall season and beyond.
So you have some slides
Mhm.
that have some great information on mental detox and other types of detox. If you could share with the listeners and the viewers.
Definitely. So let's kind of start by talking about what mental detoxification means. And as I alluded to earlier, our bodies are under such a huge amount of stress on a daily basis. And the problem with that is that stress can cause your hormones to be imbalanced. And one hormone specifically is called cortisol. And when that cortisol is elevated, your body is in what we call this fight or flight response, where, if you imagine all day it's on edge and you're feeling as if you're being, scared or chased by a bear is the way I describe it to my patients. So we really want to work on calming that cortisol response. And that's one of the main purposes of doing mental detoxification strategies. And the easiest way to start with that is mindfulness. Some people think mindfulness requires 30 minutes to an hour of a specific technique. But mindfulness can simply mean just being mindful of the activities that you're doing, or even setting 5 to 10 minutes a day to do deep breathing, techniques. Inhale 2, exhale 4. Doing that about 3 to 4, minutes a day is really relaxing. Exercises and activities like yoga, of course, that helps you kind of reset that what we call adrenal axis, lower that cortisol, and decreasing those negative thoughts. It's so easy to get overwhelmed about negative things, Jay, things that are going on around you and your family, in the home, in the world. And you want to work on changing those because those tend to also contribute to high levels of cortisol. And essential oils. I found that essential oils can be great, easy ways to calm you, either diffusing them in your home or rubbing them on your feet. As you know, Jay, I'm a mother of 3-year-old triplets. And when they were first getting sleep training, I used to use lavender oil quite often to calm them down. And it worked really well. And lavender, just in diffusing it or putting it on your feet. And there are numerous companies out there that produce essential oils. Also, jasmine and rose essential oil. Those are some very common, easy strategies that don't require you necessarily taking them orally, which some of them you can, but just making that environment around you more calm. There are also supplements, and I always recommend to patients that if you're going to incorporate any of the supplements, because we're going to be mentioning quite a few today, that you do it under the guidance of a physician to make sure there are no other complications that they can have in your health. So things like GABA or L-theanine, saffron, SAMe, magnesium, those are all great supplements that help to calm the mind and can help really get you more centered. Making sure you have a good sleep hygiene. All right, Jay, that's extremely important because when you sleep, that's really where that cortisol response is reset. And I don't know how many patients of mine will say, I am so tired when I wake up and I'm so exhausted throughout the day. And my first question is, well, how well are you sleeping? And when you get those good night's sleep, how much better do you feel the next day? And it really requires that you get like a really good sleep hygiene, trying to go to bed at the same time every night. If you're having problems with insomnia, making sure you turn off all those devices. You should be trying to go to sleep in a safe environment. So that might mean turning on that light, putting on those essential oils, making the room calm and dark, no televisions, no telephone, kind of decreasing all of those electronic magnetic frequencies at bedtime, and making sure there are no health conditions like snoring, which could be a sign of sleep apnea. So making sure you have quality sleep and you're doing things that really calm your adrenals is essential. And that's a first really good way to get the detoxification plan going.
So I think, Dr. Cornish, your next slide focuses on this, on sleep. And this to me is probably the most important slide that I think, and especially when you mention focus on sleep. So I'll let you continue. This right here is probably the most important slide for me.
Yeah. And that's the physical detox. And the reason I mentioned sleep also as a preview and the mental detox, because it does reset the central nervous system and it does allow for that cortisol response to be lower. What I find a lot of times is I'll have patients who have chronic anxiety or chronic insomnia, daytime sleepiness. And when I do evaluations for them in my practice, I'll do what you call an adrenal salivary test. And what that translates to is me monitoring, allowing for me to monitor that cortisol response all day, in the morning, late afternoon, early evening, and at bedtime, just to see where that adrenaline is, to see if sometimes patients will have high levels of that stress cortisol hormone while they should be sleeping. And there are approaches to that. Another thing I commonly find is that patients have sleep apnea. So that means that as you're sleeping, your brain is not getting the oxygen that it needs to heal those brain cells and to give it those nutrients that are required. So at times, that's kind of the first step to healing in my mind. If you're not sleeping, you're not healing. If you're not sleeping, you're not detoxing. So when I ask patients about that, ask your partner if you snore. Ask your partner if you stop breathing while you're sleeping. Those are kind of great questions that can be indicative of more serious health conditions that would need to be evaluated by your physician, because you have to focus on resetting those adrenals and, more importantly, having at least 6 to 8 hours, 8 hours preferably, of deep restorative, non-fractured, which means uninterrupted sleep. Another common reason that patients have sleep disorders and can't really do that physical detox is because of pain issues. And I always tell patients that's something that definitely needs to be addressed. If you find that chronic pain is preventing you from getting that, non-fractured sleep, that's going to prevent detox. And that's also going to cause other health conditions down the road. And then the last thing is frequent urination, waking up multiple times to use the bathroom, right? And that causes interruption in your central nervous system and that detoxification pathway. But more importantly, it can prevent you from getting into deep REM sleep. So things like not drinking water later than, 7 or 8 p.m. or at least 2 hours or so before bedtime is important to try to see if that decreases your nighttime urination. And if it doesn't, try to get that also evaluated by your physician, because frequency of nighttime urination could also be another healthcare condition that warrants further exploration. And other things you can do. So we've talked about sleep. That's imperative. That's the cornerstone of physical detox. But sweating means using a sauna that provides infrared lighting at 100 to 125 degrees Fahrenheit and pushing those toxins out your pores. that serves as a really good form of cardiovascular activity and detox. And also sweating things out the body can clear some of those toxins out your skin. And exercise. Minimally 30 minutes is what's preferred to get of cardiovascular activity. But if you're not physically active and you're trying to get started with a plan, try at least 5 to 10 minutes around your block or in your neighborhood. But you have to get that cardiovascular activity in your program if you're going to do a quality detoxification program. And I'm a big fan of hyperbaric oxygen therapy. You know, they're shown literature that hyperbaric oxygen is a great way for you to boost your detoxification antioxidants. So just giving that brain more than 100% of oxygen at a time for maybe 60 to 90 minutes, if you have access, is a great way to not only clear things specifically like mold toxins and other environmental toxins, but giving your brain nutrients, giving your brain oxygen, which helps the red blood cells circulate. Epsom salt baths and bentonite clay, very easy to do. If you like taking baths, put some Epsom salt, take one at night. And once again, that allows for sweating, that allows that magnesium to pull those toxins right out of your skin. I don't know. I can't tell you how great I feel after I take one of my baths at night, just kind of really allowing me to cleanse. And it's easy to do, you know. And with bentonite clay, that's also something easy. A lot of people might do bentonite clay foot baths or bentonite clay facial mask, or that's just a clay that also will draw toxins out of the skin. So there are different physical detoxification ways that I've described that are appropriate no matter what your lifestyle is, no matter how active you are, you can always get started. And even if you just say, hey, I'm not that active and I want a new approach to this, start with sweating, start with sauna, start with a bath and work your way up. And if you're starting physical activity, start with 10 minutes and build up to that 30 minutes as long as you're not pushing yourself too much and causing crash, which is what we call post-exertional fatigue. So this is a great way to get started in utilizing, physical detox methods.
Wow, a lot of good information, When it comes to hyperbaric oxygen therapy, does the Amen Clinic have the hyperbaric oxygen chambers?
We do. Unfortunately, with COVID at this time, we're not utilizing our soft shell chambers, but we have seen that there has been benefit with soft shell chambers to improve neurological function, to improve neurological healing, to assist with detoxification. Especially, I prescribe it a lot for my patients because those low pressures in a soft shell have been researched and associated with removing mold toxins, which is a very, very important toxin to be aware of because it causes neurological dysfunction, chronic fatigue, among other symptoms. But there are things you can do like renting hyperbaric chambers through different organizations. And then if you have a hard shell, which are harder shell chambers that allow for you to treat wider ranges of conditions, you'll really start treating other issues like strokes or chronic infections or neurological changes. But if you want to just really focus primarily on detox, once COVID pandemic is over and we have reentry, that is definitely something we offer at the Amen Clinic here in Reston.
Great. So you talked a little bit about the mental detox, the physical detox. Now, what supplements or nutritional things that we could do to help with detoxification?
So nutritional detoxification, well, we're not referring to things like water fast or, I have patients who do just juice fast for a week. We're talking about a comprehensive approach to nutritional supplements and lifestyles that will aid that liver and that kidney at pushing those toxins out of the body and decreasing your toxic burden. One of the easiest things to do, is green smoothies. Every morning, my 4-year-old toddlers, they drink a green smoothie with something as simple as kale, spinach. We may put a little bit of apple in there, just to get in some ginger, just to get some, cruciferous vegetables and antioxidants in their bodies. And I drink one as well. At the Amen Clinic, we also recently developed a greens drink. So it's very delicious because, you can try different supplements out there, different powders, but I really like our green supplement because it's rich in greens that kind of lower something called histamine. And histamine is what's released when you have allergies. And too much histamine can cause toxicity. So really trying to get on a good plan of increasing those cruciferous vegetables is essential because that's what the liver needs to help pull the toxins out the body and produce a wonderful free radical scavenger or antioxidant called glutathione, which we'll discuss a little later. You also want to try to remove inflammatory foods. At the center, at the clinic, I always give my patients what I call 3 to 7 day liver fast, which I'm also going to provide for our listeners and viewers today. I have a slide that I've created just for that, but it just includes introducing a lot of those foods that I said are what we think of as liver healthy. Also removing things like gluten and dairy and sugar, which we know can be not only inflammatory, but at times can cause toxins. Even trying to do that for a short period of time will help that liver and your body reset itself so that you're really equipped at clearing and decreasing that toxic burden. And things like water, making sure you're drinking minimally as adults 2 liters of water a day and simply putting a little lemon in your water in the morning. That's a great way to get your day started. Squeezing half a lemon in 6 to 8 ounces of water when you first wake up gives that liver a boost. It gives it ability to start filtering all that junk and all those toxins that you've been exposed to the day before and digesting your meals. I don't know how many patients I work with that just tell me, I forget to chew. When you're chewing your meals, making sure that when you're eating, that you break it down so that it's liquid before you swallow. It's very simple, and not just taking food and just chomping it down aggressively. And also making sure when you eat, you don't have any other health issues, because things like reflux or things like something called leaky gut, those could all be signs that there are toxins in your gut. So we want to make sure we're giving the body the nutrients that we need from foods, because food is our medicine, but we also want to make sure the body is able to absorb the nutrients from the food. So if you find yourself having problems with digestion, or you're uncomfortable after your meals, or bloating after your meals, or having heartburn, that could be definitely a sign that there is toxicity in your gut. And that's one of the things that I treat all the time, is making sure patients have optimized gut health, because that's another way that we move toxins out, and that you have regular bowel movements. At my office, it's kind of a joke. I'm known as the poop queen, because patients give me little emojis with poop emojis and thank you cards, because they really understand that the gut is the second brain. And when you're constipated, you're like a septic tank. To give you a visual, all the waste that you've eaten or you breathe or you've been exposed to is just circulating in the body. And constipation is, my worst enemy for patients. You need to have at least 1 to 2 bowel movements a day to optimally detox that gut. And, if you're not having that, things like magnesium or aloe vera juice or, simple things over the counter like fiber will help you with that, among other numerous strategies. And making sure you're not eating foods that cause constipation. Because like we said, it's all about the basics: sleep, nutrition, activity for physical activity, but also the gut. You have to get the toxins out the gut. And I can't stress that enough.
Wow. So, now let's kind of move on to where you see a patient that is chronically inflamed because they do have some kind of an infection, and you have put them on these other types of detox. Now, I know you have a very robust IV infusion program that you kind of get them started on these infusions to kind of do a boost in a way to, in a layman's terms. So could you talk a little bit more about your IV infusion program that helps detoxification?
Yeah, so when we're utilizing intravenous detoxification, that's just a way to bypass the gut and really get the body the nutrients that it needs straight through the veins. So it's very systemic. Some of the oral nutrients that can be used in conjunction with the intravenous program are listed here. And this is something I really want the listeners and the viewers to look at. Things like milk thistle that help really charge the liver, glutathione, which we're going to talk about in a second, that I referred to earlier, that helps the liver push the toxins out. N-acetylcysteine, or NAC, some people may be aware of. It actually helps the body create more glutathione. Turmeric, easy. It's what you find in Indian spice. You get it when you eat Indian curry. You can find it in tablet form. It's very safe. Magnesium. Another thing we talked about with Epsom salt baths, but a supplement over the counter. Chlorella, which is an algae, a binder that help pull those toxins and draw them out of the body. And things like vitamin D, B12, and folic acid, which is what we use in our IV nutritional therapy. So at our clinic, we do IVs at least once a week. And IV nutrition can be so life-changing because what some of these infusions do is that they incorporate a lot of the vitamins and the nutrients that help the liver process all the toxins and help you rapidly clear it out the body. One specifically is Myers Cocktail. And Myers Cocktail includes B vitamins, vitamin C, and magnesium, all of which are great cofactors that help supercharge your liver and detox you rapidly. IV fluids, normal saline for those who might be dehydrated or might have poor fluid intake, or sometimes when patients have low blood pressure. There's a condition that I treat quite often, a very severe condition called autonomic dysfunction, which is when patients stand up rapidly from lying to standing. They get really dizzy, really woozy because the blood pressure drops suddenly. So IV fluids not only can help detox the body, but can help with cardiovascular abnormalities. We also do IV vitamin C. And IV vitamin C has been shown to be helpful in the literature for COVID prevention and immune support. And we provide anywhere from 25 to 50 grams of IV vitamin C here in our clinic. But more importantly, we also provide glutathione. So you get a supercharge, which is much more effective than the oral glutathione. And I can't tell you how many patients after they get that boost, they even can see those changes immediately. And it's so beneficial and it's so worthwhile. And even for our listeners and viewers today, we're going to be offering discounts for infusions, for first-time infusions at our clinic, because we understand the importance of really recharging the immune system to prepare for this flu and COVID season. Glutathione, it has been shown in a recent paper by Dr. Richard Horowitz that low levels of glutathione in the body made patients more susceptible to serious complications from COVID-19. And we feel that it's important that you increase that free radical scavenger, as I mentioned earlier, and great antioxidant to boost your immune system. And it may, like the literature shows, may be helpful with COVID immune boosting, just like vitamin C. So we also do injections of vitamin B12 that have been found to be very useful. And we collaborate with the compounding center for that as well. And some patients get them weekly just to give them that supercharge that they can get ready for their day, for their month. But I think us offering the infusions, especially at a time like this, and you utilizing that supercharged reboot of your immune system can be quite beneficial in some patients as we get the body more equipped to fight off a lot of these viruses that we're going to be exposed to during this fall and winter season, and that we're being exposed to right now as we speak. So, yeah, I'm a big fan. And one other thing, Jay, I wanted to mention are also some immune system support that you can use in conjunction with the infusions, just to boost your immune system against the viruses like COVID-19 and flu as well. So some natural antivirals like lysine and caprylic acid. One of my favorites is Tacuna by, it's like a liquid drop by a company, Nutrimetics, that really is shown to be antiviral. And Hatunia is another liquid herbal that they're doing research, integrative research with COVID-19 and being one of those potential immune boosting agent. Things like transfer factors, which are things that boost up your natural immune cells. They're in mushrooms, among others. And another one of my favorites that I have patients put in their arsenals is Japanese knotweed. But as I stated, whenever you're starting new supplements, make sure you're doing the right type of supplements under the guidance of a physician who's trained in the management of these conditions. But more importantly, you want to make sure that if you do have other health conditions, that these supplements and infusions don't cause any more harm based on your medical history.
Thanks for mentioning that, Dr. Cornish. So literally today in this talk, you have taken down, you have broken it down to physical detoxification, mental detox, some nutritional supplements you can take to detox your liver and your kidneys. What I want, if you could wrap this up for us, tell us why is the detox so important and why now?
Yes. So as we know, we are living in a pandemic, and we're also transitioning to the flu season. And we want to make sure we equip the community with natural ways to boost your body in order to be able to not only try to prevent negative consequences from these illnesses, but if you do suffer from one of these conditions, kind of combat it. Fall time is great because it's right before the holidays. And like Thanksgiving or any other holidays you may celebrate where the food may not be as healthy, but it's also just changing the mindset going forward and just making you just a healthier you. When it comes to the detox organs, utilizing the detox for the liver is key because that's one of our major detox organs, the liver and the gallbladder, and just pushing those toxins rapidly out the body. Making sure we're utilizing the central nervous system, the brain, because that is a major detox organ. And we have to make sure we optimize the gut because gut and the brain, it's called the gut-brain axis, are really well connected. And you'll be so surprised how just making nutritional changes, if that's in infusions or oral nutrition or dietary changes, will really allow for your body to not only filter toxins out, but it will lower your current toxin burden. Sometimes when you transition to doing more of a liver detoxification program or strategy, it sometimes makes you feel worse before you feel better. My 3 to 7 day liver detoxification plan that I tell my patients to incorporate just really includes 3 to 7 days of good grains, fruits, and vegetables only. You know, you try to avoid the dairy, you try to avoid the meat, you avoid the gluten, and you avoid the sugar. And the reason I always say 3 to 7 days is because that first 3 days is usually the hardest because you're going to be releasing toxins from your cells in such a high volume that the liver has to catch up with filtering them out. And, you know, you may feel it sometimes. You might get headaches and a little irritable when you don't eat for a long period of time. And that's because the body has kind of started that detox process. But usually by day 7, you feel like a sense of euphoria. And there are other, ways you can start detoxing at home with cookbooks. You know, at the Amen Clinic, we have a great cookbook by Dr. Amen and his wife called The Brain Warrior Way. I mean, that's amazing at giving you easy recipes because eating detoxification foods are much easier than you think. Trying to make sure you have colorful foods with your meals, increasing those cruciferous vegetables like spinach and cauliflower and Brussels sprouts and kale and those green smoothies I mentioned earlier are going to help with all those different layers of detox, the brain, the gut, the liver. And that's what we want to do. We want to be supercharged for the next season so that when we are out there, we are ready to combat all of these different pathogens that are coming our way. So these are things that the whole entire body, a whole entire family can use. As far as the nutritional strategies, kids can incorporate that. If you have a child that hates their vegetables, try something like, our super green smoothie powder to kind of get the cheat in there. You're kind of cheating. There's also juices like Juice Plus where you can kind of cheat and give your kids 3 to 4 servings of fruits and vegetables or even yourself. But making sure that you focus on kind of resetting the body. And I think once you do that, you're going to really feel a huge difference. And it's going to have an impact not only in your life, but in your family's life. So that's kind of why it's important that you detox and that you do it safely and you take a comprehensive approach.
Well, Dr. Cornish, thank you for sharing all this valuable information today with us. Now, if someone wanted to do a consult with you or meet with you, what's the best way to reach you? Or even, you talked about your IV infusion. How would they get in touch with you?
Yeah, so they would be able to call the Amen Clinic at 703-880-4000. We're located in Reston, Virginia, to make an appointment with myself, Dr. Eboni Cornish. And if you wanted to focus on an integrative appointment looking at chronic infections, mold detox, environmental toxins, just working on a good comprehensive detox plan today, guided under a physician, or the nutritional strategies, you could definitely call our clinic. We'll be here to help you and answer all of your questions. If you wanted to contact our clinic for intravenous detoxification. Our detox code will be detox10. You'll have to mention this webinar or this podcast for that code for the complement or the detox discount in Infusions. And, you could email us, at restinpcc@amenclinic.com. And we also have listed here our community outreach managers, Kathleen and Maria, who are also very useful people to help us get you started with our clinic.
Well, we're going to also have a link to these slides, and we'll mention the code in the description of the webinar. And I can be reached via email at j@compoundingcenter.com. If you have any comments or questions, feel free to reach out to us. Thank you.
Thank you.